Hello everyone, welcome to another episode of Two Health Talk, a show where we talk about real health challenges and get to break it down in a very simple and honest conversation. Today is a very special day because I have a special
Oh my
guest.
god.
She's our first nurse in the show. It's
Oh really?
yeah,
I
the
didn't
first,
know
the
that.
first
That's
nurse in the
nice.
show.
Such
Yeah,
an honor.
yeah. So on behalf of the entire crew and everyone, I'm introducing Nurse Kosi.
Hi.
Yeah, my school is a very, like very close friend, family, like everything I could describe. Like
Oh
she's
my
that
god.
person.
I'm flattered. Thank you.
Yeah, and thank you for for coming on the show. I know you are very very busy. And,
Thanks for having me.
thanks for coming. Was it stressful coming here?
Oh no, I took a boat ride, so it was like straight from the house. So
Or
yes, yeah.
okay, I was thinking you drive.
No, I was tired, so I just took cab.
Oh, okay.
Yeah.
So having you on the show, like I had to reflect on bringing you on the show because most of the people that have come on the show are like doctors, consultant, pharmacist, and
Very serious people.
yeah, very serious people. And now bringing you, I have another nurse in mind, but I just feel like okay, there's this backstory of even me going into like healthcare
Okay.
when it comes to like there's this backstory of you
Oh, I
being
see.
involved and stuff like that. But that's what I'm like.
I didn't know that actually.
You
But okay.
so like I just want to know like I've seen you perform your nursing duty with
Okay.
so much compassion and so much care. And I remember that time we were working on the Adult Foundation
Yeah.
and you know you were so compassionate about your job. So like what is it like? Like where did this you being a nurse like where did you get started from?
I think it's more of me as a person because even outside my like role as a nurse, I'm generally, I mean, maybe not to toot my own horn, but I would say I'm a generally caring person.
Yeah,
So
sure, I know.
I guess probably that's where the love stemmed from. It's like it's something I've always done. So I have a lot of siblings, not a lot, but like a number. So caring for people is not something that's new because with siblings they're always, oh please I want to do this, please help me with this, please help me. So it's kind of like something I've always grown up with. So it just comes natural to me to be interested about what people feel. So yeah, I think basically that's where it comes from.
So what's actually inspired you to become a nurse?
I would say caring for people is one thing. Then I've also come to realize that people are different. Like what works for A might not work for B, and that's like something interesting. Like I've always wanted to figure out how people work in the sense that, or when people don't feel up to doing anything, like when someone is ill and they just want to not exist anymore. There's this sense of, oh, I just want to be alone. I just want to just give up on everything. But with nursing, you sort of have to encourage people to pull out of that sense. So I think that kind of the fact that, oh, I want to care for someone, I want to make someone feel better about themselves, even when they don't feel up to it. I think that also, I'm like, okay, this could be something I could turn into like a career kind of. So yeah, I would say that inspired me to be a nurse.
Wow, that's cool. So what's like the typical day like of a nurse? Like just typical day as a nurse?
Like a typical role,
Yeah.
like a typical, okay,
Yeah.
yeah. Well, nursing basically involves like I said, caring. So you're basically checking up on the patients, you're monitoring their overall well-being, monitoring vitals, giving medications, educating the patients on their condition, their illness, their medication as well. So yeah, but every day is different because I mean it's a hospital, so it's a clinic rather. So and people are different. So every day might be different. You might have maybe today might be very chaotic, or tomorrow might be just eh. But generally, like the role is almost the same thing. It might just be of different speeds when it comes to people. But generally, it's just looking after people, making sure they are okay. Any changes, you take note of changes that happen, whether good or bad. So yeah.
So now I know like there've been so many misconceptions about nursing.
Yeah, a lot, a whole
So
lot.
like thinking like two like
I mean, there's
things.
this one that people I know people think, oh, nurses just follow what the doctor says, or nurses are just errand people for doctors. That comes up a lot. And then there's also, oh, nurses are promiscuous. I think someone has told me that before. So yeah, that one too is there. But I don't know where the conception stems from. But at least the latter, like the nurses are promiscuous thing. I don't know where the conception stems from, so I can't really like say like um why it shouldn't be. But the fact that people think, oh, nurses are just errand people. Well, I wouldn't say nurses are errand people. Nurses are independent professionals on their own. Because you can make an assessment as a nurse and say, oh, this patient is having so complication. I think you should do this. The only difference is doctors are authorized to make a prescription. That's the only difference in the role. But every other thing the doctor does, the nurses can't do that. It's basically the same school, the same anatomy and physiology they do. We do it too, if not more, because like you're like at the forefront of the patient, so you really have to know everything. So I don't know where the conception is from, but yeah, that's one of the conceptions. And then there's also the nurses are promiscuous thing. For some reason, I don't know, they think nurses are ashawo, I don't know.
Oh my.
So I think someone said, oh, it's because of the uniform. But I mean, it's not my fault that the uniform is a dress that is somewhat tight. So I can't really dispute the fact that people think that, but I want nurses to be seen in a different light. I like the fact that most hospitals are branching out of the gown, like the white gown that nurses always wear. So yeah, I think that also helps with bringing nurses into a better light. So yeah.
Oh, so like, do you feel bad when people say, "Oh,
Yes,
ourselves"?
it makes me feel really bad because I'm like, no, like it's really not the case because it kind of like dims the light on what the profession actually is, and it loses its respect because of that too. So yeah, it makes me feel bad, especially when people say nurses are just errand people. It's like an insult to my personality. What do you mean by that?
You know,
But yeah,
for the nurses, for like that word they say nurses are young people. I saw this fight between nurses and Chu on TikTok.
oh
Like I was like,
yeah.
oh, like they're insulting nurses and
I
like,
think that too also dims the light of nursing, like because you have a lot of secondary people that can or are most likely coming up to replace nurses, not necessarily replace, but like be in the same standard as nurses. So it also like most hospitals now have started employing CHOOS, like community health extension workers. That's what it choose. So they started employing CHOOS to fill up the roles of nurses, but it doesn't work that way because our scope of what's it called now? Our scope of work is not the same thing. So you can't possibly replace a nurse with a CHO. And then CHOs are the ones that actually do what the doctor says because they don't know what they're actually supposed to do. So because everybody's just saying, oh, this person is in the hospital, this is wearing white, oh, this person is probably a nurse. So that kind of also spreads the narrative that oh, nurses are errand people. Not to dim any light on like choose or anything. I'm not throwing shade here. I'm just saying I mean everybody should come for me. But like I'm just saying like that because I have seen it happen like firsthand. So I know like oh this probably where like the concept of oh nurses are errand people, that's where it comes
so
from.
it comes from the fact that oh, there's Chu and Chu.
No, not from the fact that it's true, but from the fact that some people don't know what they're actually supposed to. Like a doctor can tell you, oh, have maybe normal saline for a patient that's hypertensive. Everybody knows a hypertensive patient is not supposed to take normal saline because that already contains salt in it. So it would most likely increase a person's blood pressure. But because you don't know your scope of work, you probably just do it just because the doctor said. But a nurse who is educated and learned will tell you, oh, I don't think you should do this because this person is hypertensive. There's going to be a repercussion in the end, which is not good for patient outcome. So yeah, I think people not knowing their actual role kind of spreads the narrative that nurses just follow what the doctor says.
So now for this Chu and nurse
Oh my
now,
God.
like last for the Chu and nurse now, I like okay when it comes to like the hospital setting,
Yeah.
like Chu comes first before the nurse.
I don't know about that, but so I don't think it is. To be fair, you see, I think another thing that promotes the nurses nurses are errand people is the fact that everybody seems to think that there's a hierarchy in the hospital. Everybody's a professional. They just have different scope of work. You can't possibly compare a doctor to a lab technician or a lab technician to a lab scientist. A lab technician and a lab scientist, they both work in the lab, but they have different roles. But you can't necessarily like say, oh, this person is higher than this person. They're just different roles. Like so you can't because it's not the only way you can say, oh, this person is higher than this person is within the particular field. Like in nursing, you can have like a senior nursing officer, you can have a director of nursing services. Obviously, a director of nursing services is higher than a senior nursing. A
Yeah.
senior nursing officer.
Sorry.
Yes. because she has more experience and this person has worked longer. So that's the only way you can compare people if they're in the same field. But if you have two different fields, you can't possibly say, oh, this person is better than this person or this person is higher than this person
So,
because the role is different.
so what's your advice to people fighting true and not just like what's your advice for them?
Well, do as you please. So I can't because I don't think it's a war that will end anytime soon. It's just like how the supposed war between doctors and nurses have been there for a very long time. So like, I don't think it's something that will end anytime soon. Because I mean, people just need to be educated that oh, these two people have different roles and the roles shouldn't encroach on each other. Like you can't possibly replace a nurse with a true. It doesn't work. You can't replace a true with a nurse. They have two different roles of practice. So everybody should just stay in their lane and just be happy with what they have chosen to do. I think that's just it. So yeah.
So like when it comes to nursing, what's the rewarding part of being?
Reward. Well, I can't say the money is rewarding, at least in this country.
Mm-hmm.
Because that's not paid enough. So I think it's just a sense of self accomplishment that, oh, okay, this stuff I did makes this person feel better. So yeah, it just helps me sleep better at night, knowing that what I do helps people. And then you see patients that are appreciative enough to say, oh my God, nurse, thank you. I feel so much better today. So that also helps with boosting confidence when it comes to work.
So can you share like a memorable experience between your patients and you? Like,
Memorable. Well, most times when people ask me this question, they expect a very lovey-dovey. But then, my most memorable experience as a nurse is actually very sad.
oh,
I don't know why.
what
Because
happened?
the first patient I lost
Wow.
was a 7-month-old child,
So
a 7-month-old boy. I can never forget that. So it's not happy, but I think it's memorable for me because it actually helped me understand like what the actual role of a nurse is. The doctors will just come do the surface work and tell you, oh, time of death is so and so, and then just leave. Like they just leave, and then they turn to the parents and say, oh, sorry, we did everything we could, but we lost him. And then they just go. But then the nurses are left to pick up the pieces.
oh,
You clean the body, you pack the corpse, and then you now turn to the parents or the relatives, whatever it is, and then you now have to do the consoling. I think that's where the difference comes in between the doctors and the nurses. You're there when the person is crying, you're there when they're packing up their stuff. You now still have to come and present the bill to the person. Oh, you still have to pay for
wow,
the child has died, oh yes, but you still have to pay.
wow.
You still have to pay for this because it's a hospital, it's not a charity, so you still have to pay for this. So I think that was I was in 400 level when that happened.
Oh,
So that has stuck with me for like a very long time.
oh,
So it has just helped me understand that oh, whatever you do as a nurse, you're always going to be the one to stick with this person till whether good or bad, you're going to be there. So that actually has been yes, most memorable experience. It's not happy, but yeah, it just stuck with me for some reason.
wow. Sorry about that.
Oh, that's fine. Thank you.
So now, you explain stuff to me now. I'm just kind of wondering: is being a nurse emotionally and physically draining?
It is. It is definitely.
Wow.
It definitely is. It will tell on you in every form, socially, emotionally, physically, mentally. Yeah, financially, God, financially, you will feel it.
So now, so now,
You will feel it.
I saw a post on Twitter
Mm.
when someone was saying nurses give out all their love, and when they get home, they don't even have any love to give at home.
Mm.
That nurses are wicked. Is that true?
Well, I don't. Like I said, I think it's based on personal experience.
Let me think. My personal experience is enough.
I think it's based on personal experience because I find that depending on the working condition, people act differently. Like you can't possibly walk into somewhere that you're paid a lot and be grumpy. I mean, you're living comfortable. Like
True.
you tend to be more receptive when you're comfortable. When you work in a government facility like me now, if you work in a government facility where you're understaffed, the infrastructure don't work quite as they should, you're underpaid as well. So everything just tells on you in every way. So like I said, it's also based on personal experience. if you're able to manage your stress or like your emotions properly, you wouldn't tend to like give it to people like in a bad way. So you're just containing everything, which kind of spreads the narrative that nurses don't have anything to give when they go back home because you already come to work and they're taking everything
True.
and then they're taking everything from you, and then you just want to go home and be loved by someone. You know, you want to be the baby now at this point.
True.
And then you get home and everybody's like, oh, mommy, please do this, mommy, do that. Oh, and then your husband is here, or this person is calling you. So, yeah, I think when it comes to nurses at home, they are different people from when they are at work. And that kind of also messes with their head in a way. So I think it's to get someone or a support system a really good support system would help. Like knowing that you can leave your work and go home and still be a person.
Well,
Yeah.
I used to hear this thing that nurses they don't have conscience, so like anything
I'm
that
just going through a lot.
like they'll tell you that see that nurse is very okay, they don't have conscience, and it's sometimes you don't get to even see it that
Yeah.
nurses
This person is
are
just
and the problem is that if a patient just die now, maybe like there's a problem somewhere or maybe there's a mistake somewhere and they'll blame the nurse.
yeah. It always happens. Like we're at the receiving end of everything.
Why?
Like if the lab doesn't work, they will blame the nurse. If the pharmacy doesn't work, they will blame the nurse. If the reception doesn't work, they will still blame the nurse. Why? Because you're closest to them. You always tend to blame people you're closest to or something that happened to you. Because I mean, if a patient is going to walk out of the room, the first person you're going to see is the nurse. Because like this is your room, this is the nurse's station. So you're walking out of the room and you're already boiling. The first person you see is the first person you always pour your anger to. So yeah, I think because nurses are the receiving end of everything, it also makes the work a little harder and it also makes it require a lot more compassion than it should. You have to understand that, oh, this person is probably just going through a lot. Because nobody wants to be in the hospital. Even the people working there don't want to be there. So
Me too. I don't want to hear it.
it's not a friendly place to be in. So I think you just have to understand that this person is going through a lot and, just suck it up. I think just suck it up.
Well, so now, if you're going to change one thing about being a nurse,
One thing, there are
Yeah.
plenty.
like change one thing in nurse, like okay, now I'll change.
Oh.
Okay, two, give me two. I'll change
I'll change
something in
or
nursing.
things
Yeah,
rather.
yeah.
I would
nursing.
say number one, especially in this country, better infrastructure. Because I think the major problem with nursing or the hospital generally is because things don't work as they should. Because if everything is working, the work will just go smoothly and there'll be less complaint because I mean the system works. But because the system doesn't work, it makes it harder for people to adjust. And then you go to school and what they teach you in school is not even what you're practicing when you graduate, that kind of thing. So yes, better infrastructure. And then I think also the career growth for nurses isn't so it's not something that is talked about enough. You just graduate and then that's the end. Nobody's asking the nurse, oh, what do you want to do after graduation? How do you want to improve your studies? Do you want to specialize? Do you want to get further education? Do you want to go into another aspect of nursing? Everybody just means, oh, you graduated now, just go to the hospital and just work. But that's not the end. Nursing is like wider than that. There are other there are other forms of nursing that people might want to look into. But because they're not aware of this information or they don't have access to the information, so people are just stuck with bedside nursing. So bedside nursing isn't the end. It's not people. Some people prefer it. I prefer it, but it's not the end. There are other aspects. So I think that also is something that should be talked about a lot.
So if you're going to talk about you talked about specialization.
Yeah.
So if you're going to specialize now, where would you like to specialize?
Hey, well, I think I've had like a rocky experience. So I'm not very sure. At first, like while in school, I always say, "Oh, I want to do pediatrics."
Pediatric.
I like children. Yeah. But then I don't think I like pediatrics. I don't think I like pediatrics anymore. It's very demanding because you're caring for both the child. The child cannot tell you what's wrong with them. So you're doing the child, you're doing the mother, you're now doing relatives at the same time. So it's very demanding. And then I also like adult care, like geriatrics. It's somewhat like child care, but like older people. Because like at the end of the day, it's like a stage. You go from child to teenager to adult, and then you're back to being a child again, even while you're old. But then the only difference is at least you can say what's wrong with you. So yeah, I think geriatric is also interesting. But I particularly like accidents and emergency because of the
Oh.
rush, like the rush of activity. But then I find that it doesn't necessarily give you a closer contact with people because you just stabilize and then you're off to the world. You stabilize, everything is fine, and then you're off to the world. So it's not like word treatment. Word treatment is longer and it's more, would I say, intimate? Maybe that's the word, I don't know. But yeah, you have like a better relationship with the patients in the ward. Although I like the rush of the accident and emergency. Yeah.
So which one are you holding up
I
to
honestly
now?
don't know. I don't know. I'm still deciding. I'm still young in the business, so I don't know. I still have time to actually decide for myself. But then I think I might do both. Like I might do like a special thing here and do another one here just to see what both of them is like before I can actually decide. Yeah.
So have you ever regretted being a nurse?
Have I regretted it? I don't think so. I just wish it was better, but I don't think it's like regret per se.
So your next one, you come out, you go and study nursing.
Before, I know then in school people used to ask me, "Oh, if we're not doing nursing, what would you do?" And I used to say, "I don't know," because I honestly don't know.
Wow.
Like, I really don't know. If I wasn't doing nursing, I don't think I would be doing something else. I don't know what else I would be doing rather. Yeah.
Oh, that's strange.
If I wasn't doing nursing, I'd probably be teaching. Maybe.
Oh, I think your parts of life is always different. Like giving that same Mother Teresa
Oh
vibe.
my God, please, what do you mean?
Okay, not this maybe I go or maybe go to convents now.
No, what do you mean?
Actually, it's not what I'm teaching. These are like
How does that relate to
passionate,
commentary?
because these are like top passionate tuition, like
And I know, but like still, comment is a lot. That's a whole lot of. What do you mean? Please, I like men.
Oh, so like, sorry. Also, if you want to, would you advise people to study nursing? Like, advise your younger
Would I advise
ones?
someone to do nursing? I think so. Yeah, it's a rewarding profession. So yes.
Wow.
But then again, I always say if you're going to do nursing, make sure you're doing it for the passion, not for the money. Because people think, oh, there's money in nursing. I'll just study nursing and then I'll just japa, or study nursing and then the money. I think you should do it because you actually want to do it, not because of the money. Because what happens if you do it and then there's no money?
So there's no money in nursing.
I'm not saying that. I'm just saying that, like in Nigeria now, there's no money for nursing in Nigeria.
Wow, I thought you
That's
guys
the
knew a lot.
issue.
So why are you trying to?
Stop it. It's not remind me. Not remind me. Not remind me. But then there's no hey, English. There's no money in nursing in Nigeria. And it's not we're not paid enough for the work we do. So if you're going to do nursing, do it because you actually like it or for the passion rather. Because it will drain you. It's very, very taxing emotionally, mentally. And if it's not something you like, if you're stressed, what becomes of you? Do you
Oh,
understand? So if you're going to do it, do it because you actually like it, because you actually enjoy it. So yeah, I would actually, yeah, you should do it. It's a very rewarding profession.
hmm.
They say, the way they used to say, oh, teachers have a place in heaven,
Heaven,
nurses
yeah.
have a place in heaven. There's nothing anyone wants to do. So yeah.
So when it comes about like male and female nurses, most people like you hardly see male like
Yeah, no nurses.
male nurses. Why?
Uh, I don't know. I think it's also a stereotype built around the profession. Because most times if you go anywhere, if you're injured or maybe you have a problem, women are more likely to help you because they say women are emotional or something. Not like they say women are emotional. So I think because of the nature of the job, it requires a lot of compassion and a lot of feelings. So I think they just see it as something women would do because it's so, oh my God, are you okay? Oh, how you feeling today? How can I help you today? But men are seeing a very, I'm a hard guy. Oh, I should be serious. I should be authoritative. So seeing men in that chummy light is not seen often. So I think that's why there's a stereotype is wrong. Although I don't. What's the word now?
Mm.
I'll get back to that. I don't think I don't think nursing is just like a woman thing. There are male nurses, and I don't think it tells any less of their personality.
But there are few.
Yes, there are very few because of the concepts, like the misconception, I mean the stereotype around it. That's why there are few. But I mean, it's a job. Anybody could be anything. It's just like how there are female engineers. I mean, nobody says anybody could be anything.
Like I can count how many million of that.
I mean, obviously, in my class we were 200 and something, and then there were only 12 boys.
Wow.
Out of 200 and something. So yeah, they're generally few. So we are encouraging like boys or men rather to take up the profession because it doesn't really, it's not a gender thing. It's a profession for God's sake. If you want to do it, just do it.
Oh. So people rush nursing
And
in every other profession now. Everybody wants to do nursing. Like, do you know why?
like I said, they want to Japan now. Who doesn't want to leave this country? That's who doesn't want to leave the country. I think nursing is the easiest way to leave the country. So that's why a lot of people are doing it.
But you know, I checked the start for salary range
Mm.
in Nigeria, and I think medical scientists earn more than
Yeah.
nurses.
Every other person in the hospital earns more than us.
Why?
I don't know. You see, it needs to pay me because I'm like, I do a lot more work than you. Why should you be paid more than I am? I mean, we go to school, it's the same number of years. I will not come out and still do internship. Then I'll not do youth service before I actually now start working. And then I start working, and then I realize that in medlab, I'm not saying it's a lower profession or anything, but like they're being paid more than nurses. Why? I don't know. Maybe because in this country we just don't value nurses, I guess. That's probably why. And maybe because we're not fighting for ourselves enough. I don't even know again.
See, for that fight, I think it's true because you see, you think like me, I just think that nurses don't have cooperation.
Gosh.
They don't have people that have cooperation. Like people might be going this side.
And then one person will do me. I think it's true. I agree. To an extent, I agree.
See, I've seen it. I don't know if it's personality wise because of you guys. I don't know, but
I don't know too.
nurses.
You can't
I've
just
seen
agree on one
for
thing.
one thing. I've seen hospitals where I work where doctors will say, "We will not consult these patients."
And
Everybody will follow. All of them say, "Yes, we are not doing it." And it is surprising. Some of them have one mind. Doctors have one mind. Same as lab scientists.
Yeah.
I've seen them say, "Okay, we're not going to do this," and like all of them stand by that.
Mm.
But nurses, if one say, if they say, "I'm not going to do this tomorrow," another one on the shift.
Well, I think it's because of the nature of the job. Because you know when it has to do with like somebody's life is at stake here. Like the strike that just happened.
Mm.
Like there were some nurses that still went to work
Oh.
because you know that this person is going to be in the hospital alone. Doctors are not going to do the role of a nurse. Obviously, nobody's going to do the role of a
Doctors
nurse.
have pride.
Oh my god. Nobody's going to do the role of a nurse. So by the time you stay and you think about that, you're like, you now start feeling for the people that are actually on the receiving end of this. And then you now figure out that this person is going against what we have actually agreed to. So I think that also contributes to it in a way.
But you guys are not the only one that took out of.
My dear, I don't know, Sha, but it's like I want oats is different because you know, I don't know, Sha, but like I don't know. I honestly don't know. It's just different with nurses because it's like I think for me, before I do anything drastic, I always think, oh, if this person was my family, what would I do? Would I do like this
But
person?
doctors always think like that. If doctors say they're not doing this,
They are not
they're
doing
not doing
that.
this.
Well, such is life. I can't say anything.
Maybe because they are guilty of it.
No, it's not. Well, it's not like I'm guilty of it. So I just understand when I see people that do it because everybody's not the same. Not everybody's a hard guy like that.
Or maybe they just pack all the salt babes
Hey,
and pack them and
maybe.
shift them.
I don't know.
People just feel it and so, Nurse Kosi is a very special person to me. Like, you know, I keep saying this. I said it at the beginning. I'm going to say it now. Like, you know, I have one fact in my heart that I'm holding to the. So thank you so much, Nurse, for coming on the
Thanks for
show
having me.
and for being our first nurse to come on the show.
Yay!
Also, it's very difficult to get a nurse on my show.
We're busy people. We can't do this.
Okay. So thanks for watching up to this moment, and for you people doing, please subscribe, like, share this video to all your family members, everybody, Thank you so much for watching. See you in our next episode. Bye.
Bye.